Welcome, Doctor. My name is Eshika Paruchuri, and I'm a sophomore at Woodbridge Academy. I appreciate you joining me in this initiative. My main focus is to educate adolescents internationally, leading them to build healthier lifestyles by collaborating with experienced doctors from various specializations. Welcome to the Healthy Teens podcast. I hope you are keeping well. This month, I'm joined by Dr. Susan Levia, who specializes in orthodontics. She provides expertise in straightening teeth and provides advice on braces, aligners, and more. And for this episode, we'll be focusing on multiple issues related to oral health and dealing with braces and aligners, as well as the steps that can be taken to have healthy teeth and a lifestyle. And now, Dr. Levia, can you give us a little background regarding your experience in this field?
Well, first I want to say hello and thank you for having me on your podcast. This is a lot of fun to be able to join you, and I know many people of younger and adolescent ages are involved in braces, so good topic to go over with them. I graduated my orthodontic residency in 1992 from NYU. I've been practicing at Monroe Orthodontics since 2007, and we are located in Monroe Township, New Jersey. It's a great honor to be working with my patients and my community, and this gives me a lot of satisfaction. It's a wonderful profession.
Very nice. Let's get started right away. What is orthodontic treatment, and what are its primary goals in teenagers?
So our basic premise of orthodontics is to move teeth, but it's not only to align them and to give a beautiful smile. It's really important for adjusting a bite, more likely than not, and that leads to a healthy individual. So it's alignment of teeth and alignment of the bite.
Okay. Why do some teens require braces or other orthodontic devices while others don't?
You know, a lot of that has to do with genetics. We are a combination of our mom and our dad and the lineage that goes with that. So many of us have large teeth and small mouths, and one could have come from mom's family, one could have come from dad's family, and then, you know, we're such a melting pot now of society that it really does take a lot to form this individual from all the different parts of our genetics. The other thing is this: it can come from habits, the reasons why we do need orthodontics, and also things such as not losing baby teeth early enough. Keeping them around too long can cause the permanent teeth to erupt in a very strange position, leading other teeth to shift. So I would say a lot of it is genetics, but not all.
Okay. What are the long-term effects of not treating misaligned teeth or jaw issues in teenagers?
Not aligning the teeth when they don't meet properly for great mastication or good chewing causes us to grind our teeth, and they may grind down in a very strange way on angles. A lot of people's teeth are angled because they've been wearing them down all their lives. Also, our jaws function in a certain way. So if our bite is thrown off by teeth that are irregular, it can start to cause jaw problems. Sometimes people have some popping and some clicking in their joints because of this difference in the bite. And ultimately, it could lead to losing teeth, which will affect our complete body health.
Interesting. How have orthodontic techniques evolved over time, and what advancements have you observed from when you first started and now?
It's quite intricate these days. Orthodontics is so different than it was years ago, which was just wires and some metal around the teeth. our braces these days are individualized per tooth with a certain amount of movement, let's say, to keep it simple, built into each brace. And then there's a brace that pertains to each single tooth. And now with advancements, we can actually formulate a set of braces for an individual person. So they have their own braces that fit and work with their own teeth. We also have things like lasers, and we have a lot of AI that's going into braces these days. We have certain surgical techniques that can be worked into our treatment, adjuncts that can help us move teeth differently. It's just a whole different ball game now than it was 20, 30, 40 years ago.
Interesting. What are the early signs that a teenager might need orthodontic treatment?
So, early signs, if you're looking at them in teenagers, is actually too late. We see things sometimes at birth with difference in bone sizes. We can see things as young as all baby teeth in the mouth without any permanent teeth and still see some issues. And so most of the time we're checking children usually as early as kindergarten, first grade, to start to formulate a plan for them in case they need early intervention, let's say.
Oh, okay, I see. What are some habits that teens should establish to ensure successful orthodontic treatment and long-term dental health?
Always. Our oral health is super important. So generally people, we ask them to brush their teeth twice a day. With braces on, we ask them to add a midday somewhere, maybe after school or something, to ensure that they're keeping their teeth clean. It is important and imperative that braces are cleaned around every surface. So brushing becomes a little bit more of a intricate procedure when you have braces on your teeth. You have to get underneath wires and around braces. We give them a lot of different tools that they can use. Flossing is another one that's really important. Going to the dentist for regular checkups and cleanings during times of orthodontics, those visits should never be missed. Those are the most important things. However, there's also the foods that we eat. For people who have braces on, it's very important that you be careful what it is that you bite into, how you bite into certain things, or maybe cutting up foods, because most of the foods we can still eat. There's also the nutrition part of this, though. We are physically, whether it's braces or Invisalign, moving teeth from one position in the bone to a new position, and our bone needs to be healthy. Our bodies need to be well nutritioned.
Okay. Based on what you have said, can you please explain the importance of proper oral hygiene and how can poor hygiene affect the outcome of orthodontic treatment?
So poor hygiene in any person can lead to cavities in the teeth. No different for braces. If the plaque and the food is not brushed away from the braces, it can cause cavities on the teeth. This can also cause, not brushing well, can also cause gum disease. Gum disease eventually can lead to bone disease and a loss of teeth. So we don't really have that many issues with bone disease, let's say, during braces, but gum disease for sure. You can get some receding gums and whatnot during the time of braces. There's also something called decalcification, where when plaque sits against the teeth, it actually draws the calcium out and leaves us with a chalky, thinner, and less strong enamel, which is the first part basically of cavities, but those are like scars on the teeth. So frequently I see people who I know have had braces in previous years, and they have those white stains left on the teeth. It doesn't come from the braces. It comes from not cleaning well around the braces. So that's the biggest issue with it.
Oh, okay. And what is the significance of maintaining a balanced diet for oral health?
We are not concrete. Our teeth are in bone, and the bone needs to be able to change, being taken away where we want to move teeth to, and being replaced by new bone where we move the teeth from. And we need our healthy bodies and good nutrients in order for that to happen. We need that balanced diet.
Can factors like anxiety or stress affect the outcome of orthodontic treatment?
I find that people who have a lot of anxiety for whichever reason, a lot of stress in their life, lead to habits such as biting nails or chewing on pencils and pens in school, or any extraneous objects that you might put in your mouth. These things are usually very hard. It's satisfying to clench your jaws around something when you're anxious. And so these hard objects very frequently tend to break the braces. This ultimately leads to longer treatment time, which can lead to issues such as the gum disease, the cavities, and decalcification of the teeth, because they're on so long without much going on.
Okay. And you've mentioned things like nail biting can also impact. So how can these habits exactly impact the braces or orthodontic devices?
It breaks them, plain and simple. It breaks these devices off the teeth. And again, anytime something's broken in a mouth, that's something that needs to be repaired, and the movements on those teeth, which affects really all of the teeth in the long run, doesn't happen during that that month until your next adjustment and until something is repaired. So this leads to longer treatment times and longer time in between where things aren't functioning as they should. It becomes an issue.
I see. What are some common orthodontic problems that you've seen in teens, and how are they typically treated?
One of the hardest parts of treatment is any portion that we need to rely on someone else to help us. So a big one is wearing any kind of appliances that you would put into your mouth, you the patient. Rubber bands would be one. Rubber bands is the most common. They need to be worn consistently and all day long in order for teeth to move properly. So when you don't wear them, it's again lost time in treatment, and nothing moves as far as the bite goes if you're not wearing them. Another appliance would be a headgear. Another example of that would be retainers. After braces come off, teeth have memory, so it is important to wear those retainers so that new young bone where we move the teeth to can strengthen around that position of the teeth when we took the braces off.
Oh, okay. How can teens protect their teeth and braces from damage during instances like playing sports or other activities?
Sports is the biggest. We protect ourselves, I feel, regularly in sports such as football and wrestling, because they are perceived as being very contact sports. So a mouth guard, and the mouth guard that's needed during orthodontic treatment is not the type that you boil and bite into so that you make teeth marks. our teeth need to be moving with the braces on throughout an entire, let's say, soccer season or football season. So they make special mouth guards that are they say 4 braces or 4 orthodontics, so that teeth can constantly be moving. But it is very important to protect our teeth during these sports. And to be honest, the sports that I see the worst injuries on are not football and wrestling, because again, we do usually protect ourselves in those sports. It would be basketball is number one, the sport that I shouldn't say no one, but very few people protect themselves, and it is a highly contact sport. There are shoulders that go up and elbows, the ball go up for jump balls, all of those things. And I've seen quite a few people who've gotten teeth knocked out basically, or moved into or forward or whatever due to those injuries. And the other one is baseball, because baseball, a lot of times a ground ball will hit a bump in the grass and take a hop. And I've seen a few people who've lost some teeth in baseball. So really important to protect yourself in all sports, for sure.
How has the COVID-19 pandemic affected orthodontic treatment?
I think that we're getting back on track in the office now, but I will say that we did a really good job on starting some virtual care, which now with braces, we don't do virtual care any longer. However, we have adopted that as a method of checking on our patients regularly with Invisalign, because they changed the aligners at home. So every week we see their progress by them taking photographs and sending them in for us. So I think that was the biggest change, really, was anything virtual. Consultations with doctors. We had consultations here virtually anytime that we could check patients, especially when they didn't have to be here per se every month, but they were wearing some elastics. We don't want them to overdo it with elastics. We want to make sure that they're ready to move on with Invisalign and all these different things. Even retainers, we could check them virtually. So I think that was a great opportunity to adapt to new situations.
Very interesting. And can you recommend some practices that teens can take after orthodontic treatment, along with wearing their retainers consistently?
Something that should be always checked after braces, especially on an adolescent or a teen, is wisdom teeth, because sometimes they start to cause a lot of pain and people may feel that they can't wear their retainer, or that the wisdom teeth are pushing on their other teeth. So definitely have the wisdom teeth checked. Regular checkups and cleanings anytime we might get a cavity in between our teeth. If that starts to narrow the tooth a little bit because of the decay, that can cause some movement of the teeth. And we don't want to lose teeth, because that can definitely cause movement of the teeth. Wearing the retainers, as I said, will help to keep the teeth in the position that they were in when the braces came off. Again, we are not concrete. These teeth are in bone, and bone is always changing. The biggest change we want to see after braces is that bone strengthening around the new position of the teeth. And then always really great oral hygiene. It's so important to keep your teeth healthy and the smile that we created beautiful.
Can you also stress the importance of good hydration?
Hydration is important for any, just life in general, and during sports, during any kind of dental work that you're getting done. But when you're wearing retainers in your mouth all of the time, this tends to, or initially when we place retainers, anything new in your mouth, your body thinks it's food and tries to break it down. So you are going to salivate. But after wearing retainers for a while, you'll see that your mouth will dry out. So really important to hydrate well because of the retainer wear and the drying of your mouth. But drying of your mouth also leads to plaque and food particles sticking to the teeth. This sticking of plaque, bacteria, food onto the teeth can lead to increased gum disease, increased decay. So hydration is very important in keeping even just your mouth very healthy.
Okay. And how often should patients visit their orthodontist after brace treatment?
This depends on really what part of treatment you're in. The advances that have been made as far as the wires that move the teeth is incredible. These wires that we use now, people can be seen once every 8, 10, 12 weeks because these wires continue to work. They are flexible wires that don't bend and continually move the teeth. So that's one reason why we can extend the treatment at a certain point. With Invisalign also, we can see patients every 3 to 4 months because they have the aligners at home to continue to change. But in the beginning, when we're trying to correct alignment, rotate teeth, level teeth, and do the initial straightening of teeth, we may need to be seen every 4 weeks, every 6 weeks. And then also, we have cases of teeth that are stuck up in the bone, and those teeth, we want to sort of tug on them frequently and give them direction to come into the mouth. We say that those teeth are impacted. And so the activating of those teeth, generally we do that every 3 to 4 weeks. So again, so it depends on where we are in treatment. Sometimes it's quick, every 3 to 4 weeks, and sometimes we can extend it to about 12 weeks or so.
Okay. Can growth spurts in teenagers affect the effectiveness of orthodontic devices?
It can affect the effectiveness. It can also sort of take us back a few steps. So people who have an overbite, meaning they have a space from where the top and the bottom teeth are, many times if we get them during puberty and they get some growth, we're hoping that that lower jaw will grow forward, and a lot of times they're wearing elastics or rubber bands that will encourage that growth, and it helps us correct that overbite. Sometimes we have people that have an underbite where the lower jaw protrudes from the upper jaw, and we basically our treatment is to try to bring the top teeth over the bottoms, and they can get a late growth phase and then grow right back into that lower jaw protrusion. So depends on what side of the fence we're on. Sometimes we want to see that growth, sometimes we don't. Doesn't matter what we want. Everybody has their own growth potential.
Interesting. Are there any specific orthodontic issues that affect teenage girls more than boys?
I don't really think so. I think that we want to see growth on every person individually. And hormones generally cause puberty to begin earlier on girls than it does on boys. So we kind of expect things at a certain age with females as opposed to males. But yet, again, everybody has their growth potential. And we sort of try to program or treatment plan the growth around that supposed time of puberty.
Okay. How does snacking on sticky or maybe hard foods throughout the day impact the treatment?
It impacts your orthodontist when you come in to visit if you haven't brushed well, but sticky things will get caught in between the braces, leading to a possibility of more decay or decalcification, those marks on the teeth, if not remedied with good brushing and good flossing. But also it can bend the wires, and hard things can break the braces. So it's hard to stay away from all candy, and it's hard to stay away from all harder foods that you really enjoy we don't want you chewing on any ice or pencils and pen caps, that definitely doesn't work. Biting on bones. People have chicken wings and ribs a lot, so those things you actually absolutely have to cut the meat off the bone. However, for sticky candies and things such as pizza crust, Doritos, bagels, we don't want to stay away from that forever, but breaking them up, chewing them on the back teeth, sticky foods, do it and then go home and please brush and floss right away afterwards. But that's usually the way they affect the braces.
Okay. And with that, we will move on to our next segment of the podcast, which consists of common myths about orthodontics. The first one, only teenagers need braces.
Definitely a myth, because most of the time we notice on younger children when there are issues and prepare for them. So many times we are starting treatment earlier these days so that we can create space in the mouth, so that we can create maybe a wider palate, which will ensure that later on we have more room for the teeth, as opposed to taking out teeth. So the thinking years ago was to wait for all of the teeth to erupt, and then it was very, very common to remove teeth. These days, we start younger, we create space earlier or save space so that we hopefully don't have to take teeth out in the future. The other thing that's going on now is they've been doing a lot of research on what happens to breathing and whatnot when we do the treatment of making the palate bigger with a palate expander, which is a very common treatment that we use earlier on to correct spacing issues. But also we've been finding that people have less issues with sleep apnea and maybe snoring at a later age, because of this opening of the palate, which opens up the airways. So it has many functions and many benefits to it, and that's something that definitely is started earlier rather than later. Later on in life, we tend to have some relapses. So we have a lot of adults that are going through treatment now, especially with Invisalign, because they're having trouble keeping their teeth clean and preventing gum and bone disease due to the irregularity of the teeth at a later stage in life. And a lot of that can actually lead to some heart disease from not being able to clean the mouth effectively enough. So really, it runs from very young ages to adulthood. A lot of people need to have their teeth aligned.
Okay. And I see you've mentioned things like sleep apnea. So I was wondering, can orthodontic treatment affect sleep, like sleep routines or?
It can. We've been finding more and more that it does help with sleep apnea when treated at an early age, because people can breathe easier. It helps with snoring also, which is just a whole plethora of sleeping issues that are affected. And then also people tend to grind less if the teeth are well aligned. So that also is helpful with a more restful sleep.
Oh, interesting. Okay, next myth. Once braces are off, teeth will stay straight forever.
So that's a common myth, because people think it's a once and done, and it can be if you wear your retainers well. But again, our teeth are not cemented in concrete. Our teeth are in bone, and our bone is constantly changing throughout our lives. From young children to teenage years is probably the biggest changes, but still after 16, 17 years old, our bone is still changing all the way through, and we're still growing till 23, 24, 25 years old. Beyond that, things change in life always, and our bone is changing in life always. So our teeth always are able to move, if not held in place well. And that doesn't have to be a retainer wear 24 hours a day, but at least at night, to sleep, definitely that's a way to hold things, but definitely not permanent position.
Okay. Invisalign and other clear aligners are less effective than traditional braces.
That is only true when they are not worn properly. Invisalign is a wonderful tool that we now have that moves the teeth without the obvious metal in our mouths. And a lot of people have been drawn to get treatment for themselves because it's not so obvious. Adults feel oftentimes a little bit self-conscious if they have braces on their teeth, but they do work well. It's more, I say, operator error, because if it's not worn as it should, it can't possibly move teeth through bone to hold in a new position without a constant force. So Invisalign is a great tool. It just needs to be worn properly.
Orthodontists and dentists are the same, except orthodontists deal with things like braces.
We are dentists. We have to go through dental school first and can definitely do the same things that the dentists do, but to specialize, we give up doing those dental treatments and stick with just aligning the teeth. When we go through our training, specialty training for orthodontics, a very large part of that is growth and development. And we learn how to affect the development for proper growth. We learn how to align the teeth for later on in life, a good biting surface for our teeth, which ultimately leads to better nutrition throughout our lives. So that extra step of learning about the growth, the development, the alignment of the teeth, and the bite is a step that is taken usually after dental school and is what sort of differentiates us.
Okay. And now we will move on to our last segment, which consists of our final questions. Can you tell us about one case that struck out to you as the patient had a very interesting problem or case with their teeth?
I have many interesting cases. I feel like every individual brings me their own special set of circumstances. But one circumstance that is challenging, let's say, is someone that has or is born with a cleft. It could be a cleft lip. It could be a double cleft lip. It could be a cleft palate. And these individuals bring very different circumstances, because when if you don't understand what a cleft is, they're born with a split either in their lip or a split in the roof of their mouth, which are generally repaired at a very young age to help a baby be able to suck on a bottle or on a breast to be able to nourish themselves. So when that's repaired, always something like that then has some scar tissue and teeth in segments of bone that are sort of split between other segments, may have teeth that erupt or grow into the mouth in different directions, in different ways. So all of that, bringing that mouth into a more normal form and function, definitely is something that brings its own set of circumstances. So those are typically very elongated treatments and special set of circumstances. I love it. It's extremely rewarding.
Interesting. So now we will go over a scenario case, and here your advice. Let's say a teenager is wearing braces and notices that one of the brackets has become loose or that a wire is poking around in their cheek, causing discomfort. The teen decides to ignore these issues and continue with their daily activities. Is it okay to ignore even small issues with braces?
If there is not a tremendous amount of pain involved, it's okay. I would suggest that they call the orthodontic office and let them know what's going on, a wire poking, a broken brace, and they will be directed what to do. If the broken brace is moving but against the tooth and not bothering them, they may be able to wait until their next visit. That's important, especially if they're away on vacation or have something going on at school, an exam, and they can't get out of the exam, so they have to wait a bit. That's great. We'll take care of it as soon as we can see them, and generally we give them some wax that they can put around it, which may stop it from moving side to side. For wire, again, if it's a little bit, that's when you sort of want to address it. Sometimes wires do slide. So if you wait until it becomes an enormous problem and it's cutting into your cheek, sometimes the office is not open late at night, and that might be when all of a sudden it really gets long. So you want to stick with, if it's a shorter piece of a wire, but it is bothering you, come in before it becomes a larger issue. However, sometimes you can use the back of a pencil, the eraser of a pencil, to push the wire away from your cheek, or the back of a spoon, something like that. So those things can help a little bit in alleviating some of those problems. But again, it's better to have it addressed when it's not a catastrophic issue, and not wait until it's really, really hurting.
Okay. And lastly, what is your take on Google Doctors?
I feel like you're always dying when you look up something on Google Doctors. So if you have questions, either call the orthodontic office or write them down so you remember to ask your dentist or your orthodontist the next time you come into the office. I'm sure that most assistants, and definitely the doctor, will be happy to give you whatever answers you're seeking, but it's better than getting a generalized, let's say, opinion on Google, where you get kind of strange and, like I said, catastrophic answers. Everybody's always dying of something when you look up something on Google Docs.
I agree with that. Okay, so our podcast session has now come to a close. I would like to thank you again for your time, insights, and contributions.
You're very welcome. It was my pleasure.
And for our listeners,
nourish your habits to flourish your lifestyle. It is really important.
Thank you.
You're welcome.
Don't forget to follow us on our website, healthyteens.net, and we'll see you again in the next episode. Bye.
Take care.